Dr. Villanueva, what do disparities in liver cancer look like, particularly for Black, Latinx, Asian, and Indigenous patients, and what can patients do to advocate for equitable treatment?
There's plenty of data, there's plenty of evidence that suggests that patients with liver cancer, African American patients, Hispanic patients with liver cancer, the outcomes are worse than for non-Hispanic white patients. And there are different reasons for that. One is because the cancer is diagnosed at more advanced stages. One of the reasons is because they are not enrolled in surveillance programs for the early detection of liver cancer. Access to curative therapies like transplant. So there are many different reasons for that. I think that, again, the best advice that I can give, and I always think I think a lot about that, is that the best thing is to prevent the cancer from developing in the first place. We have very effective treatments for hepatitis C. We have very good treatments for hepatitis B. They don't cure hepatitis B, but they prevent the complications for hepatitis B. There are also treatments to treat fatty liver, which is emerging as another cause of cirrhosis in patients with diabetes and metabolic syndrome. So if you get tested and you're found to have hepatitis C and you're cured for hepatitis C, the likelihood of you developing liver cancer is very low. So, I think it's better to go to the core problem, which is risk. Know your risk and do something about the risk factors. If you were exposed and you were infected for hepatitis C, you can be treated just 3 months, 1 tablet a day, barely any side effects, and we cure everybody. And you just stop the progression for the development of liver cancer. So I think that's my recommendation.
Okay, thank you. And I do have a question. You had mentioned something that's rare, that's fairly prevalent is fatty liver disease. And I just met with a group of people that we were all talking about that a little bit. Are there things that patients can do when they have that to cure them of fatty liver disease? Is there a cure for that?
So fatty liver has emerged as one of the more rapidly increasing causes of liver cancer in the US. And so fatty liver is very common. There are 80 million Americans with fatty liver. Most of them will have no problem as a result of the fatty liver. A small percentage of them, for reasons that we don't know, there's some genetic components, but we don't know exactly why, the fat will cause inflammation in the liver. The inflammation will make the liver develop scar. The liver becomes stiff. There's a lot of stiffness, is what we call cirrhosis. So there are medications that are approved that are effective at decreasing the scarring in the liver as a result of the fat in the liver. So we know that there's something that can be done about that. But the best thing is weight loss. So if you have fatty liver and you lose 10% of your body weight, that improves dramatically the health of your liver. So to your point, fatty liver is increasing. There are more liver cancer as a result of cirrhosis due to fat in the liver. But the things that people can do. There are medications that we can give to decrease the scarring, and there's lifestyle change that can prevent the developing or the progression of the scarring in